I'm a pediatric oncologist, and for a long time we have been operating under the assumption that we can take drugs that have been developed in adults and apply them to children. And I think what we're learning more and more as we get more genomic data to describe pediatric cancers is that pediatric cancers are very, very different from adults, and the therapies that are out there right now are unlikely to work for a majority of patients. We need to think about developing novel therapies that are designed specifically for kids and not assume that drugs that were developed for adults will work in children. There's some obvious differences between pediatric and adult cancers. Children don't get colon cancer or prostate cancer or breast cancer. They get cancers in tissues that aren't necessarily exposed to a lifetime of use and abuse, right? There's no lung cancer in kids. They get cancers in tissues that are protected from the environment, brain, soft tissues, bone marrow. And the malignancies form even shortly after birth. They form at a time when exposures aren't the highest risk for disease. And I think that's different than a lot of adult malignancies. So we've known that for a long time. But even where children and adults share the same type of cancer, acute myeloid leukemia, for example, or sarcoma, for example, we're starting to understand now that the genetic basis, the genetic driver events in pediatric and adult tumors are vastly different. Children with acute myeloid leukemia tend to get large structural events, mutations that define their malignancy, whereas adults will get acquisition of a series of point mutations that define their AML. At any rate, to get back to your question, the treatment has to be different. Right now we have a toolbox that's full of a bunch of sledgehammers, and that's all we have for many of these treatments. As we get more and more genetic information about the driver events, the mutations that are causing pediatric cancers, we can start to get more precise therapies that are designed to treat the cancer and have fewer side effects.